Hello, everyone. It's Dr. Alma Nenshi, and I am so excited to be here today. This is our second webinar of the series that I hope is going to really help you understand different aspects of your body and your health. I see that we have a lot of attendees coming in right now, so I'll just take a minute just to introduce myself. This webinar is going to be recorded, so I wanted to make sure that you understand that. And that if you have any questions or anything like that, please type them into the question and answer box, and we'll be happy to make sure we include that as part of the Q&A at the end of the seminar. I don't know if you guys can see my little, my window or my box. Can everyone just type in whether you can see me as well as the presentation, or is it just the presentation? Someone going to type in? Okay, well, I'm not sure how to do this. Oh, you see me. Yay, wonderful. Okay. You know, the last time I did the webinar, I didn't have my camera on me, so I actually didn't show up on the webinar teaching it. So I was surprised at that. And so at the end, when I was going through the webinar, I thought, well, I don't see my box anywhere. How come I'm not on there? So now I know that I'm going to be recorded here with you. And it's also nice to be able to communicate different ideas when you're able to see the person who's speaking about them. So I'd like to get started with the webinar and to talk about this whole concept of back pain, because that's one of the many reasons that people come in and see me in my office. I'm Dr. Alma Nenshi. I should have introduced myself at the beginning. And this is my 21st year in practice. And I've been a chiropractor for, I think, since I was 12, because that's when I first decided I was going to do this when I grew up. So I'm very excited to be here and share some of the information here today with you. One of the things that we need to know about back pain is that it's one of the leading causes of a lot of challenges with people. And if we just look at the statistics, just even in terms of the back pain statistics that we have, back pain includes upper, lower, and middle back pain. And it involves nerve and muscular problems, degenerative disc disease, arthritis. Oops, let me get back into here. And a lot of the things that happen with back pain, I'm just going to find my mouse here. See, when I started doing the seminar here, I've never used 3 screens at once, so I'm going to just quickly scroll over. Oh, there I am. Okay, good. Sorry about that. So back pain includes lower, mid, and upper back pain. Sometimes there are nerves that are influenced, such as the sciatic nerve. And the sciatic nerve is a big bundle of nerves that comes down into the lower part of your back and down into your leg. Nerve and muscular problems, degenerative disc disease, arthritis, all of these can cause back pain. And back pain is one of the most common reasons why people go to a doctor, whether it's a chiropractor or a medical doctor. And it's one of the leading reasons why people miss work. It's a leading cause of disability worldwide. So experts estimate that as much as 80% of the population will experience back pain at some time in their lives. And most of these back pain cases are mechanical or non-organic in nature, meaning that they're not caused by severe conditions such as inflammatory arthritis or infection, fracture, cancer, any number of these things. So common signs and symptoms of back pain may include shooting or stabbing pain, pain that radiates down your leg or even in your arms, pain that worsens with bending, lifting, standing, or walking, and pain that improves with reclining. So when you take the pressure off, this flexion posture, that seems to help certain types of back pain. So there are 2 types of back pain. They're not all the same. They're categorized as mechanical and inflammatory. So they have very similar symptoms, but the cause of each of these is very different. So let's take a look a more in-depth look. So mechanical back pain is a common condition, and it can be quite deep. It can be quite agonizing, as you can see in this picture. This gentleman has some really severe back pain. And the term mechanical means that the source of the pain may be in the spinal joints or the discs or the vertebrae or the soft tissue, something that is structural in nature. And so symptoms from this type of mechanical back pain can appear at any age. It can worsen with exercise. When addressing mechanical back pain, we're looking at rest and relaxation. That can sometimes help ease the symptoms initially. Certainly we don't want to do that for too much longer, because then if you don't use it, you lose it. So you can cause some of these muscles to begin firing at poor functional patterns. And usually mechanical back pain will resolve within about 4 to 6 weeks of time. So when you're looking at inflammatory back pain, this is a little bit different. This form of back pain is usually chronic. It usually, the symptoms subside, but the actual back pain never really goes away. It's kind of like that aching, persistent, nagging type of discomfort that people may have that never seems to go away. And symptoms typically appear around age 25 with pain and stiffness, reduced range of motion. They may last for a few months. And then the discomfort worsens sometimes more in the morning and evenings. First thing in the morning when you've been stiff all night long and you wake up and all of a sudden you're asked to start engaging in your daily routines, and that stiffness comes in the morning. Then once you start moving around, things feel a little bit better. And then at the end of the day, unfortunately, because of fatigue, these soft tissues and other aspects of the inflammation start to increase again in the evening, and so your pain comes back. Now, exercise can provide relief when it comes to this form of back pain. And in fact, if you're inactive for long periods of time, this can make this back pain worse. So we want to make sure that there is some activity. The discomfort, like I said, can affect your sleep quality. And it's one of the reasons why people with inflammatory back pain tend to have also experience a lot of sleep challenges and sleep disruptions. And inflammatory back pain is usually caused by an underlying autoimmune condition as well. So when we're talking about autoimmunity, this occurs when healthy cells in the body start to attack the body. So normally when you have an immune response, your body will attack foreign substances that are not healthy for it. There is a miscommunication in how the body works with immunity. When you have autoimmunity, auto means self, so you're actually attacking your own cells, your own healthy cells, in response to an inflammatory response. So simply defined, affected cells produce these proteins that cause inflammation, and then that leads to painful symptoms such as lower back pain, stiffness, reduced mobility, which can interfere with even, simple activities like brushing your teeth or washing dishes. While you may not want to wash dishes, anyways. Some examples of common autoimmune conditions include rheumatoid arthritis, lupus, inflammatory bowel disease, multiple sclerosis, and type 1 diabetes, psoriasis. Okay. All right, so another type of problem can be ankylosing spondylitis. Now, this is an autoimmune inflammatory condition. It's primarily diagnosed in young adults and primarily in young men. And it's a form of inflammation in the back that causes stiffness and reduced mobility because it's an arthritic process that causes levels of the spine to start fusing together. And it causes you to have a very forward hunched posture as well. So ankylosing spondylitis is actually very difficult to diagnose. There's x-rays that can be taken that can pick up on some of the arthritic changes in the spine. That you can have blood tests that can also find markers in the blood that correspond to ankylosing spondylitis. Specifically HLA-B27 is what they're looking for. That might be too technical. But it does happen in about 1 in 20 people who experience low back pain and have been given the ankylosing spondylitis diagnosis. Okay. So we've mentioned this term of inflammation several times now. So what is inflammation? So inflammation plays a vital role in the immune system response to injury and infection. It's the body's way of signaling the immune system to heal and repair damaged tissue. And it also helps the immune system defend itself against foreign invaders like viruses and bacteria and other pathogens. So inflammation is actually really critical for healing. Without it, wounds and infections could be quite deadly. The inflammatory process becomes problematic when the inflammation continues to be there, even though the cause of that inflammation is now looked after. So sometimes what happens is you can hurt your back, you can get an inflammatory response. The inflammatory response brings all this extra nutrients and resources to the area so that your body can get to work to repair and help fix the problem. And then we expect that inflammation to go away once everything is looked after. And when the inflammation or the inflammatory process still occurs, then it can lead to a lot of other type of problems later on down the road. And we want to try and help this inflammation go away appropriately. Many diseases such as heart disease, stroke, rheumatoid arthritis, lupus, these have all been linked to chronic inflammation. But the good news is having a healthy diet and lifestyle can really help keep chronic inflammation under control. So the exact cause of back pain can be challenging to identify. It's hard to determine whether something is mechanical in nature or whether something is more inflammatory or autoimmune. So we want to try and help to understand what conditions are commonly linked to back pain. So these include muscle and ligament strain, so repetitive heavy lifting or a sudden awkward movement can strain your back muscles and your spinal ligaments. And if you are in poor physical condition, constant strain to your back can also cause painful muscle spasms. So bulging and ruptured discs are also a cause for back pain. Discs are like cushions. They sit in, so if you have a vertebra and you have two vertebrae kind of standing on top of each other, the middle part here is called a disc. And the disc has an outer fibrous area that is protective and kind of contains the disc in its entirety. And in between, there's a small little nucleus that is formed of very acidic material. And so when you have disc problems or disc challenges, sometimes that outer layer starts to fracture and the middle material starts to leak out. And that's what's called a herniated or bulging disc. And sometimes it's the mechanical pressure of that disc on the nerve that can cause nerve pain. Other times it's the acidity from that nucleus in the disc that's interacting with the fatty tissue of the nerve. And when you mix something that's acidic and it starts to erode the outer layers of the nerve, that itself can be quite damaging to the nerve and can cause pain as well. So disc injuries aren't just something is pressing on the nerve, that happens actually quite rarely, maybe in 1 to 3% of the population. Most often it's the inflammatory reaction that's happening from the changing chemical environment around the nerve that causes the nerve to have these types of pain symptoms. And also there are studies that show 80% of asymptomatic people between age 20 and 50 actually do have disc problems when you take these individuals and you perform MRIs on their spine. 80% of them will show some disc challenges. So if you have something that's an incidental finding on an x-ray, doesn't mean that you have to have back pain. But know that you're not alone, that a lot of people have disc problems and disc injuries, and they themselves don't cause the back pain. Your lifestyle can make a huge impact on how you're going to respond. Arthritis is another thing that causes back pain. Osteoarthritis is usually caused from repetitive wear and tear in the affected areas, and sometimes the arthritis can actually narrow. So if you've got your spine, you've got a spinal cord that's traveling down, and the arthritis can actually narrow the space in which that spinal cord is traveling in your spine, and this is called spinal stenosis. And this can happen when the vertebrae can start aligning themselves out of sync, and it can also be caused from trauma and repetitive injuries, whiplash, those types of things. There are skeletal irregularities as well. So common skeletal irregularity that I see in my clinic all the time is scoliosis. The scoliosis is when you have a sideways curve that's happening in your spine. Most people don't recognize that they have scoliosis till well into their 30s and 40s, unless they've had x-rays in the past for another condition that may have shown that. Osteoporosis, your spine's vertebrae can develop compression fractures if the bones become porous and brittle. And so lack of activity, lack of weight-bearing exercises, poor diet, diet that lacks in essential vitamins and minerals for bone health, and also a family history of osteoporosis can also predispose you to having osteoporosis. Okay. So while anyone can develop back pain, even sometimes children can have back pain. Think about, I think they say there are 5,000 micro injuries that happen in children just to, while in the first year of life when you're learning how to walk. Think about how many times you have a child stand up and fall down as you're trying to practice these motor patterns. So children can experience back pain and teens can experience back pain, but there are some things that put you at a higher risk than other people for developing back pain. So age is one of them. Back pain is definitely more common as you get older, starting at around age 30 or 40. Lack of exercise is another reason why you can have back pain. If you have weak muscles or muscles that aren't used very often, they become weak because of disuse. And these are muscles in your back and your abdomen. They might lead to back pain. Excess weight gain is another reason why people can have stress on their back. There are some diseases like different types of arthritides, cancer, these can all contribute to back pain. Certainly, we talked about this, improper lifting, wear and tear in your spine. So when you lift, instead of using your back, think of children when they want to pick something up, they squat down and they pick things up. They use their legs. So this is something that, as adults, we should be practicing as well. And psychological conditions, sometimes people who are prone to depression and anxiety also have a greater risk of getting back pain. Smoking, smoking reduces the amount of oxygen that is available to tissues. And so this reduces blood flow to the lower spine, which can then keep your body from delivering enough oxygen and nutrients to the discs in your back. And also smoking slows down healing of these injured tissues. So now that you have an understanding of the different types of back pain and some of the causes of back pain, we can talk about ways that we can manage back pain and discomfort. So these are at-home strategies as well as therapies that you can get outside. I understand that we are in the process of physical distancing now, but there are many ways to address and prevent back pain, and I hope that you learn from these different strategies I'm going to present now. So mechanical or acute conditions need to be addressed differently than chronic conditions. So at-home pain relief measures could be, in the short term, maybe a little bit of bed rest, just for patients who have severe back pain and muscle spasms to try and ease the stress on those muscles while they're trying to recuperate. But I wouldn't recommend more than bed rest for more than maybe a day or two at the most. We don't really want to have too much of that. We have to engage those muscles. Physical activity, in some cases, doctors recommend to have early physical activity. Even if you do have a little discomfort, it's better to kind of walk it off and move and try and get some recovery by using those muscles that are injured. Again, you need to listen to your inner voice, and if you have excruciating back pain, maybe the rest initially is more appropriate, and then go in and start walking and stretching and moving. For moderate to mild back pain, some patients are encouraged to maintain, a near normal schedule. If you have, moderate to mild back pain right from the start, just go about your day, and be careful, but don't baby things. Don't excessively look to try and rest those areas if you can get through your normal activities. Ice and heat can help too if you apply ice and heat alternating to the back. I think back when I was teaching first aid with the Red Cross, we were saying don't ice anything more than 10 to 15 minutes at a time, because your body tends to have a reflex reaction where it thinks it's starting to get frostbite, and it will shunt a whole bunch of blood to the area. So icing for about 10 minutes to 15 minutes is fine. And then you can apply heat alternating back and forth. If you feel that one offers you more relief than the other, let's say you really enjoy the heat more than the ice, it's okay to do more heat, right? You don't have to do things with ice and heat if you feel that it's not physically making a difference with your symptoms. So, who's the real doctor here? The real doctor is right here up between your ears. You are healing inside your body, so you have to use your intuition. You have to try different therapies and see which actually seems to resonate with you. We always suggest you start alternating ice and heat, but if one tends to help you more than the other, then stick with that for a little bit longer. Okay? All right. So generally, when we're talking about ice and heat, just apply it 2 to 3 times a day, alternating. Okay? So when it comes to using your body properly, we want to try and avoid movements that are going to cause you to twist or strain your back. So when you're standing, you want to stand upright, you want your shoulders back. Always remember to arch your lower back whenever you're sitting or you're standing, because then that tends to help straighten up everything above. If you must stand for long periods and you have back pain, maybe you've got a low footstool, or I don't know if people still have those old phone books laying around, but we used to say, throw a wedge or something on the floor and you can put your foot on in order to try and alleviate some of the stress on your back. So just kind of shift your weight on a little stool or something where you can rest your leg. You want to try and keep your pelvis in a neutral position wherever possible. And so good posture is really important and will reduce the stress on your back. And then when you choose to, when you're sitting, when you choose to sit down, make sure if you do have armrests or low back support, use those. And if you don't have that, you can always take a towel and roll it up so that it just ends up being like a little bit of a support, and just wedge it up in the small of your back. And that will help to remind you to maintain that normal curve in your back when you're sitting. You want to keep your knees and your hips at about the same level. You can even slightly lower your knees a little bit lower than your hips, but generally at about the same level. And then change your position frequently. You know, every half hour you want to get up and, you know, get a sip of water or just stretch, and that would really help you. You want to be lifting smart. Again, you got to remember, when you lift something heavy, you're going to bend down with your legs and lift up with your legs rather than putting all of the load in your arms and your back and arching your back up. You want to keep your back straight when you're lifting, so bend only at the knees, and hold the load close to your body. Don't reach out and hold something far away. Keep it close to your body as you carry it, and that'll reduce the lever force for those muscles in your back that have to contract and help you maintain that load. And certainly, I mean, find a partner, find someone that's in your area to help you lift, because lifting heavy or very large objects can be quite awkward, and I certainly don't want anyone to get hurt because they're just trying to do too much than they're supposed to. Okay, so let's try and figure out how we can stay strong. You know, once your low back pain has calmed down, we usually say that exercise, I usually tell my patients to exercise when they feel their low back has gone away by about 75 to 80%. And that way we can prevent future episodes of back pain. We want to try and work the muscles. We want to try and include as many extensor muscles as possible, because those are the ones that are going to help create that stability for you. So we want to try and have some strong hip and pelvic muscles. So the abdominal muscles are important, but a lot of people think of the abdominal muscles as those sit-up muscles, the rectus abdominis muscles that, you know, offer you the six-pack. And those actually are not involved in core stability as much as the transverse oblique muscles that are located, that attach from your rib cage all the way down into your pelvis. So there are specific exercises that you can do that can help you, and we actually have the links for all of this at the end. Actually, I do like this link. If you want to jot this down, and I'll put up a slide with all of the references at the end here, but if you want to jot this down, it's https://www.medicalnewstoday.com/articles/32320.php. That's a great link for certain exercises that you can perform at home. They've got pictures and things that you can follow along with. That would really help. I'm going to see if I might be able to just click on this. Oops, go back up here. I hit escape. Here we go. Minimize this. And sorry guys, I'm going to try and see if, so there's another image here, another website. This will also be on your references that talk about neck releases and stretches that you can do. But this wasn't the one that I was looking for. So we'll just skip that and go back to the presentation here. All right. So how are you guys finding this presentation so far? I am going to send out the links to you. I see that someone sent in a question. We'll talk about that in a few minutes. But yes, I do have the website addresses. I'd be happy to email them out to you. These links are really great, and I would really love it if all of you could spend a few minutes to try, change my camera, to try and get familiar with some of these stretches and things that you can do at home that can help you. There are resources online, so we don't have to reinvent the wheel. And I do want to acknowledge all of the references during the presentation so we know that that's something that's going to help. All right. So we're going to go on to sitting. Okay, so lengthy bouts of sitting are the enemy. So you want to try and get up at least 20 minutes or so, every 20 minutes or so, and stretch, right? So whether it's walking around the office, you know, doing lunges, reaching up overhead, you know, that sun salutation that people do with their lunges, those are really good stretching exercises. And we want to try and help you so that, you know, if you do stretches regularly through your sitting day, you're going to enhance the extensor tone in your back, which when you're sitting, imagine your legs, you know, you're sitting with your legs across, and so you're contracting all of your flexors and your hips. And so standing up and doing lunges are a great way of trying to stretch those hip flexors out, which would be really good. And, you know, there's a whole bunch of information online about how to set up your desk in an ergonomic way that is healthy for you. There's lots of tips on doing that online. If you want, you know, email me and I can arrange a special Zoom meeting with you where if you want to just show me what your desk looks like, we can try and work out the kinks on Zoom to try and help you figure out how best you can work at home or even at work. If you wanted, I'd be happy to help you out with that, with the Zoom meetings and having a private session with you. So just let me know, and certainly I can do that. So we talked about posture. You know, having good posture is really, really important. But you have to, first of all, be aware of some of the bad things that are happening. And one of the references that you have is going to be csiortho.com. And it's a posture test. So you can go in and you can actually test to see how your posture is. So that's going to be part of the references that I'm going to give you at the end here. You will need to have someone work with you on that because you'll be standing up and they'll ask you to measure the distance behind your neck to the wall and the arch of your back to the wall. And you want to make sure that you're doing it correctly. So make sure you have a friend that can help you with that test, and you can both do it together. You can help each other out. And just so you know, if you don't go online and you want to test this, you shouldn't be more than 2 inches from the wall, from the arch of your neck or the arch of your back to the wall. So when you stand up against the wall, there shouldn't be more than 2 inches behind that curve and your wall. So if you do have more than 2 inches, that can be a problem, and you probably have bad posture and possibly a curved spine. So, you know, I think for women on the call here, a lot of us like to wear heels. And so when you have back pain, you want to kind of swap those out. Let's try and wear, you know, flats or lower heels in order to try and create a little bit more stability when you walk. And it will reduce the pressure on your lower back when you have heels, because when you're wearing heels, it causes your rear to stick out a little bit, and it just causes this anterior posture. When you have the flats, it helps to maintain that steady upright posture. And if you smoke, we alluded to this, maybe it's time to quit. You know, smoking can increase your risk for osteoporosis of the spine and other bone problems that can in turn lead to compression fractures and other problems. It does reduce the amount of oxygen available to the tissues for healing. And recent research found that smokers are more likely to have lower back pain compared to non-smokers. Let's try and watch our weight. Diet and exercise are really important. We want everyone to be within their healthy range for their height and their weight. And being overweight puts excess stress on your spine. So here's where the problem is. People are overweight, it hurts their back, they can't go out and be active, and so on and so forth. Well, you know, there are other things that we could do. We can work on trying to help reduce diet, inflammatory issues in our diet. And there is a website that's really good that talks about anti-inflammatory foods that you can eat. It's www.verywellhealth.com/anti-inflammatory diet. So if that's something that you're interested in checking out, that would be a great resource for you as well. So a lot of times people go to physical therapy when they have back problems. Physical therapy is one option. You know, they have a lot of modalities using heat and ice. TENS is a superficial electric, like a small machine that delivers very low level frequencies that can help with superficial pain. Ultrasound is another way of offering deep heat for soft tissues that may be affected, but it is contraindicated for people who have metal implants. You don't want to put heat into a metal, just not a good idea. So if you have shoulder or hip or knee replacements that have metal in them, probably not the best to use ultrasound. But in any case, you know, physical therapy and chiropractic too were really great in trying to create stretching and strengthening programs that can help you in order to alleviate some of the stress on your back. Everybody loves massage. Massage can be used for many types of back pain, and especially when it's used in adjunct to other types of medical treatments. So the research shows that massage therapy increases blood flow and circulation, which then brings the needed nutrition to the muscles and tissues. And this aids in recovery of muscle soreness and helps to get the person more physically active and reduces soft tissue injuries such as muscle strain. It also reduces tension in the muscles, and that can help improve flexibility, and it increases your feel-good endorphins in your body, these chemicals that enhance mood, ease depression and anxiety, and also help to speed up recovery, especially for those suffering with chronic back and neck problems. We don't have massage therapy or physiotherapy in our office, but we do have several therapies that can be used to produce the same type of effects, and we'll talk about those in just a little bit. Acupuncture is an ancient Chinese physical therapy that has become quite popular, and it's well researched for managing pain. And so basically what you do is you put very tiny needles into the skin, and the point is to try and increase blood flow and circulation. And so the needles are very skinny, they don't hurt at all. Some people don't even notice them going in. I've been practicing Chinese acupuncture for as long as I've been practicing chiropractic, which is now 21 years. And, you know, for those acute patients that have a really hot low back, it's one of those things that I do that just helps to alleviate a lot of the local inflammation and gets the person so that they can stand up and actually load their bodies and physically move around. So acupuncture is really great for that. And, you know, it's really great therapy. So the reason why acupuncture works is it's thought to stimulate the central nervous system because of the stimulation of the needles onto the skin and activating certain receptors. And that releases opioid-like chemicals in the body and certain neurotransmitters, and basically helps to trigger the electromagnetic impulses in the body. So really great therapy, and highly recommend that, something that we do all the time in clinic. So one of the other things that we do, and this was the last minute add-in, is my frequency-specific microcurrent therapy. And this technology has been used since the 1920s, and it is based on resonance. So we've all heard of the opera singer that can match her tone and resonate her voice at a certain pitch that will interact with glass molecules in like a lead crystal glass and shatter the glass. And this is because the energy, the vibrational energy from what's holding the glass molecules together and the energy from the voice, when they interact, because they match, they create a little bit of a disruption in the stability of that. And of course, that causes the glass to shatter. Well, similarly, we have a technology that is run on microcurrents, and microcurrents are 1/1000th of the intensity of a TENS machine. So it's something that you don't even feel. Microcurrents are basically the signaling that's happening every day in your body right now, as you are sending signals to all parts of your body. You don't actually feel the electrical signals, but they are happening because you need your heart to beat, you need your lungs to fill up, you need to digest your lunch. There's so many different functions in the body, and they all need to be controlled by your brain. And so your brain sends electrical microcurrent signals through the body in order to do that. So what we do in our office is we have something called frequency-specific microcurrent. We have found that in the same way that you can use molecules to resonate together to disrupt, you can dissolve scar tissue adhesions, you can repair tendons, you can reduce inflammation, you can improve circulation, you can relax tissues. All of these are effects of the frequency-specific microcurrent, which is pretty amazing. And, you know, that's why I don't have the massage therapy and the physical therapy in my clinic, because I could have someone go into the back room, get very relaxing light and sound therapy, sleep on a massage bed, have a microcurrent running, they take a half-hour nap, and they come out feeling like $1,000,000 because all of their muscles are completely relaxed and their pain is reduced too. And so that's a really special therapy that we have in our clinic. And if you need more information, just email me. I'll be happy to share that. So chiropractic adjustments, you know, chiropractic is, like I said at the beginning of the workshop, it's something that I believe I was born into. You know, when I was very young, I knew that I wanted to do this, and I'm so blessed to have been given this opportunity to serve patients in this way. Chiropractic adjustments are synonymous for back pain, low back pain, neck pain, headaches. That's what a lot of people think chiropractors help with. And, you know, many studies have concluded that, you know, manual therapies like chiropractic can really be useful, effective therapies for lower back pain, and also for disc injuries, radiculopathy, neck pain, and a whole bunch of other conditions. So we don't just treat the local area, we treat the whole body, because your nervous system is from your brain down to your whole body, to your toes. And so, you know, some people are concerned about this popping sound that happens when you crack your joints, and it doesn't have to be that way. There are very gentle instruments and vibrational therapies that can also help offer a lower level of chiropractic intensity in your adjustments. And it works well. It works really well. And I think that there are a lot of great ways to gently help to improve alignment in your spine, and chiropractic is definitely one of them. So how exactly does chiropractic work? You know, chiropractic focuses on increasing the firing of joint mechanoreceptors in the spine. So these are highest concentration in the spine. So basically you've got fast receptors and you've got slow receptors. So you remember that story, the turtle and the hare, right? Pain signals travel very slowly in your body. If I bang my elbow on something, what's my instinct? My instinct is to go in and start rubbing it. And why do I rub it? Because I want the fast mechanoreceptors to override the pain signal. I want those mechanical receptors, like these little bunnies, to get to my brain and have me perceive the rubbing instead of focusing on the turtles or the pain. So we want to be in a position where we're trying to help modulate pain. It doesn't stop the turtles from entering into the nervous system and activating your parietal lobe and saying, hey, I feel an ouch. But what it does, it helps distract your attention, so you're not only seeing the pain signals, but you're also seeing other vibration and mechanoreceptor input that can distract from the intensity of pain that you're feeling. And that's how chiropractic actually works. So signals from the muscles and joints, they do travel faster than the pain signals. And what happens is when these signals get up to the brain, they release these neurotransmitters. They release serotonin and norepinephrine. And these neurotransmitters descend down in the spinal cord. And essentially, they block the pain signals from entering into the spine, which is why it's so effective. You can stimulate these mechanoreceptors with chiropractic care, and then over time feel less pain because you have enough serotonin and norepinephrine in the cord that is virtually blocking those pain signals from entering into the cord in the first place. So that's a little bit of a scientific background on how chiropractic works, but it's pretty phenomenal. And those of you who have had chiropractic care in the past can attest to, how the pain almost instantaneously reduces, and in some cases is eliminated altogether with your chiropractic adjustments. So I'm very happy to be part of this profession to help people. So let's go into our references for today. I'm going to just put them all up here. So I don't know if you want to take a screenshot of this. If you want to save this, I can certainly copy and paste this and send it out to all of you. I think that there are some really great resources online. Each one of these has helped to create this presentation, and I'm very grateful for these. And I think that, how much you invest in your health, how much you pay attention to your diet, movement, exercise, stretching, your positive self-talk, things that make you feel that the world is, or the cup is half full and not half empty, that the world has hope and that there is a silver lining amongst any tribulation we have. I think that that is really, really important in trying to give you a positive outlook on whether you're going to recuperate from your back pain versus, oh, I'm going to have this forever. It just never goes away. I'm so sick and tired. Well, then you're attracting the sick and tiredness into your life. So just my 2 cents worth. I think that it's important to have a positive framework, a positive outlook when you are injured. Let's talk about the things you are in control of. What are some of the things you can influence? And maybe it could be guided visualizations of you thinking about moving without pain. Because when the research shows that athletes who visualize success actually have a higher ability to reach that success at a faster rate than people who don't. So I think the guided visualizations, even when you're in pain and you can't move, use those guided visualizations. Eat an antioxidant rich diet and anti-inflammatory diet. And, just try and take one step at a time. I think that's the biggest thing. Do what you can do and feel grateful that you at least were able to do that. Gratitude is so powerful in life. So with that, I'm going to put up a little picture of my favorite guy next to my kids and my husband, of course, but my favorite guy in the office. And I think most people come to the office because they want to meet him instead of me. But Shadow, he's just such a lovely, lovely animal. And he just turned 2 last week. So we're celebrating that here at home. And I want to thank you for your attention. And next Wednesday, every Wednesday, we're having a webinar. Next Wednesday's webinar at 1 o'clock is going to be on shoulder pain solutions. So if you like this webinar, that's awesome. Next week, we're going to do something similar. We're going to go through a variety of different shoulder problems that people experience and try and help them overcome these problems. So that's about it. I'm going to go on and just stop this recording right now, and that way we can answer some of our questions.